Hello, and thank you for joining me today with pharmacodynamics and legal and ethical considerations of the drug Griseofulvin. Griseofulvin, or under the Australian brand name Griseofulvin, is an FDA-approved antifungal medication available in the Pharmaceutical Benefits Scheme. It is used in treating types of dermatophytosis. Common uses for Griseofulvin include fungal infections of the scalp, finger and toenails, jock itch, and ringworm. Griseofulvin is typically used after topical creams have proven to be ineffective. This antifungal agent remains an essential tool in fights against fungal infections and is listed on the World Health Organization's list of essential medicines. The most common side effects include nausea, headache, diarrhea, and anorexia. Always ask your doctor or refer to the label for a complete list of side effects and seek medical attention if you experience any severe reactions or allergy symptoms. Griseofulvin can impact the liver, and although rarely linked to acute drug-induced liver injury, is advised against in cases of existing liver disease. Griseofulvin should be avoided before and during pregnancy due to potentiated harm and abnormalities to the unborn baby. Manufacturers also advise against breastfeeding due to possible drug excretion. Griseofulvin is an inducer of cytochrome P450 and so interacts with other medications that metabolize similarly, specifically anticoagulants like warfarin. If our patient is on blood thinners, regular monitoring and administration adjustments may need to be taken for dosages to counteract any reduced effectiveness. The National Consumers League, FDA, NIH, and manufacturers all warn of potentiated effects of alcohol, including increased effects of alcohol, disulfiram-like reactions, and tachycardia. Contraceptive efficacy is also decreased during Griseofulvin administration and is recommended to consult your doctor about using non-hormonal birth control aids. Griseofulvin is absorbed in the gastrointestinal tract, specifically the duodenum. Griseofulvin is highly lipophilic and dissolution rate is low. Because of this, its water solubility is also low and has high permeability. Griseofulvin's effectiveness is greatly enhanced when taken with fatty fluids and foods to help counteract its low water solubility and to slow gastric emptying. Griseofulvin concentrates and deposits within keratin layers. It becomes tightly bound to the keratin precursor cells binding on microtubules. Griseofulvin is excreted in the urine as well as the feces and sweat glands. Griseofulvin binds to keratin cells in places like the surface of our skin. It inhibits fungal cell mitosis and metaphase, stopping duplication and spread of fungal infection. This antimicrobial activity is a result of binding to cellular structures. As well as interfering with fungal mitosis, Griseofulvin changes keratin precursor cells to become resistant to fungal infections. Skin is replaced with these keratin Griseofulvin complexes, allowing it to effectively combat dermatophytosis. So due to working through cell division, Griseofulvin needs to be taken anywhere from 2 weeks to 6 months, depending on infection type. Griseofulvin is an FDA-approved and PBS S4 drug. This is a prescription-only medicine and must be obtained through a pharmacy with a valid prescription. The Medicines and Poisons Act of 2019 requires that it has strict medical supervision and/or direction. S4 drugs on wards must be stored in a secured location, such as a medication trolley, medication room, or when appropriate, a patient's locked bedside cabinet. Unused, damaged, or expired medication needs to be disposed of safely and with consideration to public and environmental safety. The National Return and Disposal of Unwanted Medicines Program have services in safely processing and destroying leftover medications. We should always be making sure our treatment plan is appropriate to our patient. Children with tinea capitis, for example, pose significant risks for permanent baldness and could lead to serious psychosocial trauma if not treated quickly. Griseofulvin along with selenium sulfide shampoo has proved very effective for tinea capitis in children. However, for someone pregnant or with acute liver disease, other options may be more appropriate. It is our responsibility to ensure the patient's best interests are being considered and that they are aware of the alternatives and risks associated. Griseofulvin also requires long-term use and may need frequent medical tests, which can be both costly and invasive. A fundamental principle of health is a patient's rights about their body and to refusing treatment. Misleading or withholding information to change that decision is a breach of that right. Remain honest about all possible side effects, alternate treatments, costs, and procedures involved. Ensure our patient is aware of their rights when discussing and deciding on a treatment plan. Patients can be referred to the Australian Charter of Healthcare Rights on the Australian Commission on Safety and Quality in Healthcare website if they are unsure or have any questions. Making sure all parties involved understand the product, procedure, and care plan is important for both healthcare workers and the patient. Avoid medical jargon when possible and understand that some people may have limitations to their reading and writing skills and language barriers. This is the end of my presentation on Griseofulvin. Thank you and have a great day.